Good afternoon. My name is Pranay Reddy, and I'm the Acting World Health Organization Director. Today, I'll be talking to you a little bit about the Ebola outbreak in the Republic of the Congo, as well as our efforts as the World Health Organization and my responsibilities as the World Health Organization Director in moving forward with this outbreak. So first, I'd like to talk about our vision as the World Health Organization. We envision a world where everyone can live healthy, productive lives, regardless of who they are or how they live or where they live. This vision comes directly from our website on the World Health Organization. It is accessible by anyone. I urge you all to visit that website and learn more about our vision. Essentially, what we see our function, what we see our effectiveness as a World Health Organization is that we are efficiently managed, adequately resourced, and results driven. And we need to have a strong focus on transparency, accountability, and especially appropriate value for money or fiscal responsibility. Our main goal in response to responding to outbreaks is that we treat outbreaks just like we would any other public health or global emergency. So we prepare for emergencies and outbreaks by first identifying and managing or mitigating any potential risks. We also seek to prevent outbreaks and encourage the development of certain tools which are necessary during these outbreaks, whether that's to prepare or to respond to the outbreaks themselves. Next, we detect and respond to outbreaks and health emergencies in a prompt and very timely manner. Time and how effectively and quickly you respond to one of these outbreaks is of the most vital importance. We also seek to support the delivery of essential services and resources during these outbreaks and other public health emergencies. So I want to talk a little bit about background on what is called the Ebola virus disease. For those of you who are not familiar with this viral illness, it is a viral hemorrhagic fever of humans and some types of primates. In the early stages, symptom-wise, it's characterized by headache, myalgias, or muscle pains, as well as sore throat, which is soon followed by diarrhea, vomiting, GI symptoms, and a pretty characteristic rash. The end stages, however, are resulting more and more in liver and kidney damage with this onset of internal and technically external bleeding, hence why it is called a hemorrhagic fever. At this time, there is no known treatment. The only means of therapy that we have are supportive measures, which is replacing fluids, electrolytes, stabilizing the patient essentially, and then managing them in a more intensive ICU type setting. So I want to talk a little bit about recent developments with the Ebola outbreak, specifically within the Republic of Congo. Just this week, there are 20 new reported cases within the Democratic Republic of Congo. I do want to emphasize that all of these statistics are available on our World Health Organization website. They are constantly updated with any new developments or news-related topics that are relevant to the Ebola outbreak itself. So of those new reported cases, we're seeing that 55% of them are new cases that are seen within Mombasa and Mandima health zones. Now, these are not provinces within the Republic of Congo. These are what we have designated as certain health zones to better identify new cases, existing cases, and to better determine these hotspots of disease frequency. So based on these numbers, we are seeing that there is a shift in the hotspots of outbreak density. We are actually seeing a big shift from more densely populated urban living environments to lower density rural environments. So this is making us come to the conclusion that community-based transmission is at an all-time high versus the traditional healthcare-based, facility-based mode of transmission. So this is a figure that I've provided. Once again, this is on our World Health Organization website. I urge you to visit that, where you can find other very vivid, illustrated depictions of what data and statistics that we have found. So this basically breaks down over the past 7 months or so number of new cases based on when the disease actually, disease onset occurred, the symptom onset. And what you're seeing, Mambalako, Mandima, Beni, Katwa, Butembo, these are different health zones. These are not the provinces. These are specific health zones that we have designated to be able to identify and collect data on existing and new cases of the Ebola virus. This is just another illustration, and where we have the larger red circles shows an actual range of new cases. So the large red circle is 8 to 14 new confirmed cases within the last 21 days. The smaller, second largest red circle is 4 to 7 new cases within the last 21 days, and the smallest red circle is 1 to 3 new cases in the last 21 days. So this is very helpful to just track where the highest density of new cases, existing cases, and then based on pink, yellow, or green, we have filled a zone. We have designated that as a zone based on time frame. So green is health areas with reported cases before the last 42 days. Yellow is health areas with reported cases within the last 22 to 42 days. And then pink zones are the health areas with reported cases within the last 21 days. So this allows us as the World Health Organization to collect our statistics and actually employ them into illustrations that show disease progression, disease tendencies, and where the disease burden currently is the highest, which is the most important factor when managing an outbreak, especially outbreaks that tend to progress and evolve, such as Ebola. This is just more about the statistics. On the furthest left-hand column, you see the different provinces, so South Kivu and North Kivu and Ituri. These are the main hotspots. These are actually the hotspots provinces that were targeted with our first attempt at controlling the Ebola virus, which is called the Strategic Response Plan, the SRP, which at its stage now is at SRP 4. And then in the next column are the actual health zones that I was referring to. And then in the next column are the confirmed cases and confirmed probable total cases with corresponding deaths. So this is just all of the raw data spit out into a very nice, almost Excel file that gives the data within each province and then within each health zone. So I want to talk a little bit about my role as the World Health Director. I am essentially the acting authority of the World Health Organization. And in terms for the relevance of this topic, it is in managing the outbreak and preventing future outbreak. Part of my responsibility as the leading authority, as the representation of the World Health Organization, is to coordinate funding efforts, resource allocation and utilization, mobilize other participating World Health Organizations, other countries to mobilize communities, to form partnerships at the national, international level, and then to coordinate these differing levels into one unit that can then be served or function as an entity that can go into the affected country, to the affected regions, and perform risk assessments, amongst many other things. So our main way of combating or managing the Ebola outbreak is through what is called the Strategic Response Plan, the SRP. You can find more information on our website about this, but I want to go over a little bit about what this entails. And like I had previously said, the SRP has been modified many times. It is now at stage SRP 4, or the Strategic Response Plan number 4. So the goal of the SRP is to coordinate and form guidelines of how we deal with outbreaks, specifically in this case, the Ebola outbreak. So the first point is to detect and rapidly isolate cases, to intensify rapid multidisciplinary public health actions around one confirmed or any confirmed case. This is facilitated by strengthening community engagement, strengthening the health system itself, the public health system, and effectively coordinating the activities of both local and international partners. So developing teams within local communities and tying them to their international partners so they can be a more cohesive effort. And then we also want to enhance the synergistic effect of the public health activities and those of security, humanitarian elements, financial elements, make sure that our operations sectors are ready, are prepared, and that our neighboring countries are prepared and willing as well to participate in this coordinated effort. So we want to create and enable an environment for the response to the outbreak. So a little bit more about the SRP. The overall goal is to strengthen political commitment, security and operational support, to strengthen support for the affected communities, and then collaborate with humanitarian efforts to provide this support, whether that's resource allocation, resource provisions, bringing in medical devices, bringing in medical support, different medications, bringing in teams of medical professionals, and then strengthening financial planning is huge. We need to work with what the organization called the World Bank to identify specific areas that have higher financial needs, and then to plan how we can collaborate to gain this financial support and then allocate that properly to the communities that need it most. Strengthen preparedness of the surrounding provinces and neighboring countries to reduce risk of further transmission or spread. This is huge, especially in something like Ebola, which is a very communicable viral disease and is highly transmissible. We need to make sure that our surrounding provinces are prepared so that we can actually limit the potential spread of this virus to more and more neighboring provinces and communities. These are my references that I have listed. All of the references that I have used, I mentioned previously, are found on our World Health Organization website. There's news articles from continuous updates on what new outbreaks are being identified, as well as resources for any communities that are already affected or suspecting that they are affected. I want to thank you for your attention. I am available via email. Please do not hesitate to contact me with any questions, concerns, or any ideas, any positive or negative feedback. I would love to hear your opinions. So please reach out to me, and I hope you enjoyed this presentation, and I look forward to working with you in the future.